Hey guys, let's take a look at the principle of beneficence. The ordinary meaning of this principle is that healthcare providers have a duty to be of benefit to the patient, as well as to take positive steps to prevent and to remove harm from the patient. These duties are viewed as rational and self-evident and are widely accepted as proper goals of medicine. This principle is at the very heart of healthcare, implying that a suffering patient can enter into a relationship with one whom society has licensed as a competent provider of medical care, trusting that the physician's chief objective is to help. The goal of providing benefit can be applied to both individual patients and to the good of society as a whole. For example, the good health of a particular patient is an appropriate goal of medicine, and the prevention of disease through research and employment of a vaccine is the same goal expanded to the population at large. It is sometimes held that the principle of non-maleficence is a constant duty. That is, one never ought to harm another individual, whereas beneficence is a limited duty. A physician has a duty to seek benefit for any or all of her patients. However, a physician may also choose whom to admit into his or her practice, and does not have a strict duty to benefit patients not acknowledged in the panel. This duty becomes complex if two patients appeal for treatment at the same moment. Some criteria of urgency might be used, or some principle of first come, first served to decide who should be helped at that moment may be employed. One clear example exists in healthcare where the principle of beneficence is given priority over the principle of autonomy. This example comes from emergency medicine. When the patient is incapacitated, that is, they can't express their preferences, by a grave accident or illness, we presume that the reasonable person would want to be treated aggressively, and we rush to provide beneficent intervention by stemming the bleeding, mending the broken bone, or suturing the wound. Now, in Western culture, when the physician asks from a benevolent spirit in providing beneficent treatment that, in the physician's opinion, is in the best interest of the patient, but without consulting the patient, or by overriding the patient's wishes, it is considered to be paternalistic. The most clear-cut case of justified paternalism is seen in the treatment of suicidal patients who are a clear and present danger to themselves. Here, the duty of beneficence requires that the physician intervene on behalf of saving the patient's life or placing the patient in a protective environment, in the belief that the patient is compromised and cannot act in his or her own best interests at that moment. As always, the facts of the case are extremely important in order to make a judgment about whether the autonomy of the patient is compromised.